Hello, I'm Violet CEO Melissa Reeder, and today I'm having a conversation with Ranjana Shrivastava. Ranjana has a very long and impressive CV. She's an oncologist, a Fulbright scholar, and an author here in Melbourne, Australia. And many of you will recognise Ranjana as a regular Guardian columnist, where she writes eloquently about that very delicate intersection between medicine and humanity. Here at Violet, we've come to recognise Ranjana as a really vital voice for the patient and the family experience around all aspects of the last stage of life and end-of-life care. And she's one of the experts that we really love to turn to, talk to and learn from when we're looking for really deep insight about the reality of what is happening for Australians and their families as they navigate the last stage of life and the end of life. Thanks for joining us. Hi, thank you for joining me today for a chat. You and I have talked at length about the experience of the last stage of life and the end of life, the way people are experiencing this across Australia today. We've talked about some of the gaps and some of the areas where we know there is real room for improvement. And we've talked about the fact that a lot of those areas are actually non-clinical in their nature. I wondered if I could just ask you to talk a little bit around how these issues, how these problems show up in the work that you do every day, in your clinical practice, in your experience with patients and family members.
Well, I think obviously, as an oncologist, I deal a lot with the clinical aspect of illness, what treatments to give, how to prevent side effects, how to keep people well while they're dealing with life-threatening illnesses, etc. I think, what I see my patients, families, and loved ones and friends going through is, I guess, making sense of the whole picture, because often medicine deals with bits and pieces of a patient's illness, but not the entire illness. So giving you an example from today, I saw a patient and I was talking about his advanced cancer and how I did not feel that some of the treatments were appropriate, etc. And we had a very long conversation, which was really focused a lot on different treatment options. And then towards the end, and I would have gotten to it, but it's always poignant. And the family member said, his son actually said, well, can we just talk about how long he has? And that it sort of really brings into focus that people are thinking through many different things while trying to make good decisions about their healthcare. And something as important as prognosis determines what somebody will do about the various treatment options offered to them. So that's something I try to remember early on. The other thing I would say for a lot of family members is just thinking through how they're going to cope with this illness in their loved one and what the implications are for them, whether it's work, taking time off, moving in with somebody. And I often think that medicine needs to do much greater justice to those concerns.
I mean, they're two really very pertinent examples. I think the first piece you've shared there around conversation and communication, it's so often that these conversations are kind of delicately avoided, aren't they? Within families, we can tend to skirt around the real question, the real conversation. It becomes the elephant in the room. And we also see that in a lot of clinical practice. Unfortunately, it's very hard to find the right context and setting to have those conversations. But I think the grain of truth in there is that honesty and kindness are not mutually exclusive. And if we can build that in the practice and in the way that people move through this life stage together, there's a lot of benefit to be had.
I would tend to agree with that. I do think that it's very difficult to have these sensitive conversations with patients and their loved ones because you so want to be able to help them and give them hope. But there is this fine line between truth-telling and navigating hope and not extinguishing hope. And I think it's really important for all of us to keep working on that.
Yeah, it's very true. And there are often conversations and truths that need some time and some processing and some reflection. So it's not possible to have them all, neatly in a consult. So I think that that's exactly right. There are other things required. I guess, while every experience is unique, there's not a standardized approach to this in any way. What are some of the other kind of gaps or themes that you see persistently in your work?
I think one would be trying to describe to the modern patient and their loved ones what the trajectory of care might look like. There are so many opinions to be had these days, unlike in the past. I saw someone last week who had come to see us for a fifth opinion. I can't imagine how 5 opinions wouldn't confuse somebody. And it seemed like, they were not quite happy with the first and the second, but at some point, I think they were probably grappling with a lot of issues and sort of emotions of their own. And I guess getting a 5th or a 6th opinion is not going to help that. So somehow communication around how much medicine is enough medicine. And this comes up in many ways for me, in particular around end-of-life care, around admission to intensive care, advanced care planning, etc. And I think my sense is that people want to deal with this, but they want somebody to hold their hand, and they want these discussions to be done with great compassion and sensitivity. And while I think the profession and everybody who works with me and alongside me and the broader profession means well, I think it would be fair to say that these discussions are not left a lot of time. And I really struggle with this. And in the short time span of some of our consultations, there are so many potential treatment options or clinical trials or other things to talk about that somehow the very human needs can take a back seat, and they shouldn't take a back seat. But this is something I think a lot of people struggle with. And you only have to be the carer of your own parents or relatives and go into a medical consultation, and you see this repeated. So it's very common.
It is, and they're deep and profound emotions that you're describing there. They're about people's willingness and readiness to be understanding and be more aware of the situation that their loved one's health is declining, and that's a measure of acceptance. That takes time. That's hard to come by, isn't it? It doesn't happen instantaneously. Well, look, I think there's a range of work to do in this area, but certainly Violet is trying hard to address some of those gaps. We completely agree that this burden can't all be placed on clinicians and on the medical system. There's no single point of accountability, but there are some real gaps in the system that we hope that we can help with. But thank you for making some time for a conversation today. I know you've got travel in the next couple of days and lots on, so I'm really grateful for the conversation.